I'm Dr. Elly Forsyth.
And I'm Dr. Crystal Wiggins.
Fancy seeing you here.
Okay. It's Kendall. But that's from 2015.
Kendall Isadore?
Isadore. Mm-hmm.
Isadore?
She was Miss Howard in 2000.
She was at Howard University?
2007, I believe. So it's
wow.
It's a medley, yeah.
She's talented.
Oh, yeah. And when she starts singing.
She sings too?
Yes.
Dang. Does she act? Is she a triple threat?
No, but she's just phenomenal, man. She is a unicorn. You don't find those every day.
You have lots of talented people in your family.
I think she's going to sing now. She has a beautiful voice.
Okay. Yeah, she's very talented.
Yeah, she's very talented, yes. She's a Houstonian.
We got to get her on the podcast.
Yeah.
Yeah.
I'm sure she'd be game.
Kendall, this is your formal invite.
Yeah. I love you, Kendall!
I'm Dr. Elly Forsyth.
And I'm Dr. Crystal Wiggins.
Fancy seeing you here. And normally we would clink our glasses right about now, but I've decided today not to pre-open the wine because I want to talk about how amazing this wine opener is.
Ta-da!
This is not an ad or anything. I just love it so much, and I think everybody should be blessed with something so amazing as this. Do you have one of these at your house?
No.
What? What do you use? Like the...
Oh, yeah. Woo, because it gives me some kind of feeling.
No, okay, I suppose that little pop you get, sure. But you have to have one of these that cuts the little top off, okay?
Uh-huh.
Okay, just a little bit of that. And it just comes right off. Ooh. And watch, I'm just going to show you how quick this is.
That frustrates me, so I would love that.
Check it. You lift it up.
Oh, I had an
You pull it down. And that's it.
Oh, it's so quiet.
It's over in 2 seconds.
It's so quiet.
There's none of this. There's no wondering if you hit the middle of the... That's all. And then it just comes... It comes right out.
We love corks.
I'm just saying. This is so wonderful.
What do you do with your
I think
corks?
I got it on Amazon. I have a saving cork thing, but it got a little excessive. So I
because you can make cork boards.
Yeah, you can do that. Ooh. Okay, so we'll talk about the wine later.
So that gadget is really
after
neat.
we drink it. Our director slash sound mic slash anything slash. Would you mind coming and get your wine, please? I can't get out. Can't squeeze out of this chair.
Y'all go ahead.
All right. Let us know when you're ready for some wine.
Cheers.
Okay.
Good stuff. Cheers. Fancy seeing you here.
Yes.
So what's it been? 3 weeks? 3 weeks?
Yes, it has.
3 weeks since
We're
Casey
gonna
was here?
kind of get a little more, probably every 2 weeks about the posting, but honestly, isn't it good?
It's
Realistically
good.
speaking, we're just so busy in this office that to even make time for something like this is literally you're carving out time. You're carving out time because day to day seeing patients, we're so booked up, which is a good
awesome.
problem to have.
Yes.
But it's when you're not seeing a patient, you're doing your paperwork, dealing with repairs, dealing with this, dealing with that, putting out fires. So it's always something. This is a nice change, though. Wouldn't you agree?
I do agree.
So
and it's fun too.
This.
You also have a family, both of you,
Oh yes,
Yeah, that too.
and a personal life.
That too.
Personal
I
life.
finally have a
Got
personal
one of
life. It's
those.
wonderful. It's great. Oh, I put my little. This is distracting. No. So, giant elephant in the room.
Yes.
Or shall we say irrigator in the room. So this is the irrigator machine, and we wanted to talk about this today because we love it so much, and we wanted everybody to know because we just have so much. It's brought so much joy. A machine has brought joy into our lives. Can you believe it?
Yes.
Would you agree?
I was afraid of it at first.
I know. I remember your face.
Yeah.
This was your face. This is what you do when you're like,
I don't know about it.
and you don't even hide it. It's so funny. You're like, I was like, this is what we're going to use now. You're like, but you know, it's a necessity to be able to remove wax as an audiologist because people come to us and yet we weren't doing it as, like, I wasn't wanting to do it very much. And I know I've talked about this before, but it's like, I would just be like, go to the ENT, the ear, nose, and throat doctor, because I don't want to deal with it. Because if somebody's on blood thinners and I'm pulling stuff out of their ear and they start bleeding, or it might take an hour, nobody got time for that.
Yeah.
And so this little creation has allowed it to come out so quickly.
Yes.
And obviously we make great videos on TikTok now because of it. So we get like footage while we're doing something that is fun. But the best thing is it's temperature regulated, and it doesn't cause dizziness for the patient.
I love it. I've grown to love it. Irrigator is my friend.
It is. And we have 2 of them now.
Yes. They are
It's a game changer, total game changer. So if you're watching this and you're a provider of anything, you're a general practitioner, you're an ENT, any kind of doctor that possibly could do wax removal, just throw away your curettes.
Yeah.
You know, just
push them to the side.
Yeah, push them to the side. Maybe don't throw them away.
Way to the side.
But this is amazing. It's like the best thing ever.
Yeah.
And I think it's a game changer for sure. People coming from like
everywhere,
hundreds of miles away, asking specifically for this machine. To me, that's insane.
Yeah.
Like to say, I want to get the irrigator, and like somebody from Jacksonville, Florida emailed us a couple of weeks ago. We have somebody from Chicago. We've had
Sacramento, California,
Virginia,
Alabama.
a ton of Mississippi's and Louisiana's and Dallas's. We did put a little button on our website on memorialhearing.com. There's a big giant red button that says something like for irrigator locations, click here, and it takes you to their site, because as much as we want to see everybody, we don't want somebody to have to drive like 8 or 10 or 12
Not unless
hours.
you just want to make the drive.
Yeah, I mean, if you want to meet us, hey, we're here.
I just hope you have wax
when
you do come.
If you don't have wax, we'll do a hearing test.
Yeah.
Next best thing. You can see what your hearing is like. But yeah, it's just crazy. And the videos that we're making are fun. Like the latest video we just did, the Grogu video. Do we have that? I love it.
He's our VIP patient. Look at that wax.
Oh, so I put thousands of years worth of buildup, and somebody did correct me. And that was a true fan right there.
He's only 50?
Grogu is only 50 years old.
We knew it was coming.
Yeah. That's why I told him. I was like, it's 50 years. And he's like, let's see if the true fan
That's how we know
out.
Alexis is paying attention. Alexis, L.A. Fountain O.
Yeah.
Oh, is that the one that made a comment?
Yeah, my arrow's on it right now.
Yeah. It's so funny.
I love it.
I love it. That was a good video.
And then, so, I guess, and I always say, and so, your industry and what you guys do is ears and hearing. And something that affects your hearing is anything blocking your hearing. And earwax serves a purpose for your body, I guess, to do what? And then, 2, I guess, to discuss when people come in and think that they have hearing problems, have you ever run into a situation where they're like, I just don't hear well, and then all of a sudden, through use of the irrigator, they can actually hear better?
Like all day.
Yeah, every day. I love to hear it.
Immediately.
Yeah, I love to hear it. So a patient comes in, they say, I really am just not hearing good. Take them to the irrigator room or our sound cafe, irrigate them, and when they say I can hear.
Wouldn't you say the very first TikTok that we did that went viral?
Yes.
The girl came in for a hearing loss. She thought she had hearing loss.
Yeah.
And she just was like, I can't hear. And we looked in,
Tons
Dr. Wiggins
wax.
looked in her ears, and she had a ton of wax. She agreed to being filmed. And I mean, that TikTok is about 20 million views at this point. And it was such an eye-opener even for us. There it is.
Yeah.
Yeah.
That's enough to block it, I'm telling you.
Oh, I mean,
But I love it when the patients say,
Yeah, I can hear.
But yeah, ooh, that sounds so good.
And so before the irrigator, what were the methods of earwax removal? And then after you guys get done saying what is the best and why is it the best?
The best. Oh, I use curettes all the time. Alligator forceps.
Curettes are these like scoopy things.
Yeah.
So it looks like a little plastic spoon, but tiny for the ear, and you stick a light, and it is bright, so it's easy to start scooping it out.
Yeah.
But it's like, just imagine an ear full of wax, like.
Yeah.
I mean, scooping and scooping and pulling and scooping.
Yeah.
It just.
And trying to roll it into a ball and get it to
grab it properly.
Yeah. I was doing
like
all
I
of
said,
that.
If they have like what do you call it? If they're on blood thinners and you scrape a little bit of their ear canal, they might start bleeding. So it's just like
that's actually happened.
Yeah. Oh yeah.
Yeah, and then alligator forceps are good. We still use those.
Yes.
Like if the irrigator gets most of it out, but there's a little flap, we just go in there and it looks like a little alligator mouth, and we grab it and pull it out. But I'm not going to sit there and do an entire ear cleaning with it.
Right.
And then other than that, suction takes forever too, and we still use suction. For ears that have
surgery,
surgical
ears
perforations, things like that. But shoot, and the reason we didn't have irrigation in this office prior to the actual irrigator machine is because most machines don't have warm water.
Right.
They're just normal temperature or cool, and that elicits vertigo, and the patient.
And trust me, you don't want that.
Yeah, they'll get dizzy and usually throw up on you.
Blah.
So we didn't want to deal with that. So this machine comes in, rolls in. It's bright, has this bright light, has this like magnification glass. Wow, that was a car accident that just happened. And
I like it for the magnification.
Yeah, it's bright. It magnifies. It's warm water. It shoots it through, and it just dumps it out.
Yeah,
and you're just like beautiful.
Yeah, watch the videos.
Yeah, watch the videos.
It's fun to do. It's fun to watch them too. Even though I've removed the wax, saw it come out, I was always go to Dr. Elly and like, let me see the video.
Yeah,
like
this is a game changer. That's why I keep saying the word game changer with this machine, because like I didn't want to deal with it before.
Right?
Don't you agree? Isn't that sad? That like, and I know I'm not alone in thinking that. Neither are you.
No, and I worked with tons of ENTs.
Yeah.
And I got frustrated with the ENTs maybe taking too long with the patient, or they having to go through their process for removing the earwax and coming back to me. So I said, let me just do it on my own. And the scraping and the pulling and all of that stuff, that was pretty extensive. This thing here has just cut my time down. Yeah, it's game changer. It cut my time down like 50-60%.
Love it a little too much.
Yeah. The patients that like their eyes roll in the back of I love seeing that though.
It's like they love it. Like literally called it's like an ear spa.
Yeah. I have used that term too. I was like, we're just going to give you the spa treatment.
Really,
make sure we get it nice and clear. But it is fun to use. I would recommend to any audiologist, and like Dr. Elly said, any professional.
I need other people to know about this too. Like if you know an ENT out there, or you know a general practitioner, who else would probably benefit? Like people need to know this is such a great thing. Like, Go be free.
It's not
to
just taking
people.
up space here. It's really, really fantastic.
And from a standpoint of anybody that has quite a few people that they deal with that may have any kind of healthcare practitioner would benefit from, because it's part of your general all-around health, right? So if you go to a general practitioner.
Yeah, because what they usually have is like this little squirt bottle that just squeezes and it falls into a little basin and it's like...
Right.
And it might be okay in a pediatric setting, but like an adult with like hard set wax, it's not really helpful if somebody's going to you as a provider in the office. I mean,
and then I've used this on peds here.
Yeah. Oh yeah, we've done as young as 4 years old. It's whatever they can tolerate. Any ear can take it.
And you just tell them it's a water gun. Yeah. They love the water gun.
As like when they call and the front office is like, hey, can we book a 5-year-old? I'm like, technically, yes, as long as a 5-year-old's not going to freak out when we're coming at them with a water gun.
Right.
But they love it. It's so cute. We should upload some of those videos too.
So not only are you able to help your patients by removing earwax more effectively than in the past, but also from a business standpoint, you're minimizing the amount of time that you spend in that process to get you back to where you need to be, which is focusing on their overall function.
Hearing health, yeah.
It's like a, what is it, one-stop shop. where before I would be recommending, like if they were occluded, I would say you need to go to your ENT and then wonder if they were going to come back to us, to be honest. Because an ENT has an audiologist on staff, so they would sometimes, if you will, steal our patients. So here I am.
I'm guilty of that. Oh, I am. Well, I mean, not so much as not on purpose, but you're already
indirectly.
here.
They're already there. Let's talk about hearing aids
Let's talk
next.
about it. Yeah.
Makes sense.
Yeah.
I ain't mad at you.
Yeah.
I mean, past you. You're
past
here
me.
now.
The past me. Yes.
But it's a two-way street, basically what you're saying.
Well,
I mean, I'm sure someone
they're
has
in
started
our
my patient,
office,
too.
so we should be able to take care of them. And if we release them, to another office for wax removal, I guess that's the chance you take. I'm wondering if they're going to come back or just do the rest of their hearing health care at that office. It makes sense.
I mean, my view is that the irrigator is going to be a gold standard for wax removal.
I don't even know what's better. There's nothing. If there was something better, I would have had it.
Yeah.
You know what I mean?
That's what I love about her.
For on an industrial
Any
level,
reason to shop.
there's nothing. There's no comparison.
No.
It's always the best.
When you're dealing with 3 patients a day, Dr. Wiggins 3 patients a day, your office is seeing potentially 6 patients a day total.
I mean, just for earwax removal, you mean?
Yeah, on a mass scale.
Oh, no. There's times where we've done like probably 8 wax removals a day each.
Yeah.
So you're just doing wax removal now?
No.
No, you're referencing just wax removal. You wouldn't do anything past the wax removal with the patient. They come in specifically just for
there's
the
plenty
wax
of people
removal.
who come we have our days scheduled sometimes a hour and a half block for a new patient to talk about hearing aids, hearing loss, tinnitus, and then that patient happens to have wax, so we add the wax removal to it.
Just yesterday.
And there's some people that are just coming
back to back,
bam, wax removal.
And tell them what happens. So when we both have a patient that needs the irrigator, the mighty irrigator, we actually have another irrigator that I can actually 2 machines, so we can put into 2 rooms.
Yeah, the other day you were in the main room, so I was like, oh, it's time to bust out the second one because I had them at the same time. So I filmed. Actually, I pulled wax and filmed in here.
Actually,
which is kind of a nice
you
change.
did that for a patient's girlfriend, right? Because you had that patient and then the girlfriend.
My dream is that we get patients at the same time who want to be filmed at the same time, who know each other, who we can do the wax at the same time.
Boom, boom. And
that's my earwax filming dream.
It'll be a double ear tundra.
No, I'm literally I tell the girls up front, if there's a because sometimes people come 3 at a time. They all want it. The problem is we're just not available at the same time. But if that ever happens, I told her we're gonna walk in with a gun together at the same time.
So Crystal, how long?
A lot of fun.
Crystal, how long have you been Memorial Hearing? How long have you been at Memorial Hearing?
6 months.
I think 6 months.
How many irrigator services have you performed?
600.
600?
Yeah.
I love that number.
I'm gonna go with that round number. I don't know.
Well, if you averaged it up real quick, and so your 5-day work week, you would do on average probably 2 a day, 10 a week.
On average, maybe.
Yeah.
10 a week times
at least.
6 months. Run those numbers out real quick. You're a valedictorian. You're a valedictorian. Go.
40
No,
times
repite
6.
otra vez. How many?
40 times 6.
10 a week.
times 4.
10 times
240.
4 weeks in a month. 240.
So 600, like I said.
No, you've done more than 240.
Yeah, I
because
think
there's
so.
some days that you've done
But
5 or 6.
we've kind of got to the point. We've kind of got to the
1, 2,
point
3,
in Memorial
4,
Hearing
5,
where
6.
the irrigators become so popular that we're looking into taking that role off of the doctors and putting that role onto somebody who would be like a hygienist.
I love it too.
We're not giving it away.
I love it.
Well, because you two guys are the faces, right? If it was
People
something
come
that
to
was
meet us,
serious,
it's kind of funny.
like if the chicken bone was
come to
found,
meet her.
and of course you would have to come in and perform the pressure test first before the hygienist or whoever would come in. So you guys would be involved. Well, I mean, what would you call it?
Ear hygienist.
I don't know.
You call it
I haven't thought that far.
a junior audiologist.
Audiologist.
Yeah,
Like there's a nurse,
Audiologist
there's a nurse
assistant.
practitioner and then there's nurses, and then there's physician's assistants. But in
So
y'all's
there's
industry,
audiology assistants, but in Texas, the rules to become an audiology assistant are way more stringent than any other state, and they have to have at least a bachelor degree, which is a lot.
can it be in business?
You could be in anything. I'm
could.
pretty sure.
So I could come in and I could apply.
You could
Do you want to be our
apply.
audiology assistant?
I would love to.
Really?
Yeah. What does it pay?
Okay, so let me just tell you this.
I'm in.
Segue. What does it pay?
Well, it's going to be a little bit of a challenge because of the height thing. I can't buy heels
be like
tall
this.
enough to. Yeah.
We'll get those chairs that you pull the lever. Go.
Yeah. Actually, our chairs are pretty tall.
They are, yeah. That's why I wear the heels.
Speaking of a height difference, did you guys see the Mayweather fight this weekend?
Yeah. Yeah.
That was a height difference. Did you not watch it?
No, I
thought
did.
you liked Mayweather.
I do.
Mayweather.
You know I do.
So the guy that runs Showtime was discussing, I can't remember his name.
Discussing how he has to give everybody a refund?
What he said, no. This was the problem with the refund situation. We fell victim. So when I buy normal pay-per-views, because we buy all fights at our house, every fight, we're going to have it. We usually buy it like the day of. Like that morning, I'll wake up and hit purchase on the pay-per-view. So when it comes time for the pay-per-view to pop up, then I'll just roll into the pay-per-view. This one, I was on the fence. So I was doing my research. I was looking. I knew it was going to be a big deal, but I didn't think I was willing to commit to it because I'm what you call a hardcore fan.
Okay.
And what this fight did was our generation, older generation, we're familiar with Mayweather because he's the greatest boxer of all time, the best hype man of all time. I mean, the guy's money Mayweather. Earned his name.
Look at his money.
The man's the man, right? So we know who Mayweather is. The younger generation knows who Logan Paul is. And the fact that it was a David versus Goliath, in my mind, I'm kind of weighing it out. That's the main event. And I was kind of interested, but I was like, you know what? I'll just watch the highlights tomorrow. And then I got to looking at it. I was like, Ocho Cinco's fighting the first fight. And we watch I Am Athlete.
Yeah.
And this is...
I Am Athlete's a great podcast.
I Am Athlete's everything to me right now. I watch everything I Am Athlete. And,
I Am Athlete, I Am Woman.
And I remember them talking about it. I just didn't realize that it was on this fight card when he was fighting because I know he's talked about it on I Am Athlete. And we watch I Am Athlete a lot. Or I do. And then Ellie's, she kind of falls victim
I'm
to me watching
to
I Am Athlete.
I like it. It's good.
And then so I'm laying on the couch. It's like 5 p.m. And I just look over. I'm like, you know what? $53.
It just goes, cook it.
Pull the trigger.
Yeah.
So the guy from Showtime said that, like, because I bought it at like 5:30 or 6:30. The fight started at 7.
Too many last minute decisions.
2 million people at like 6:50
I don't care.
bought
That's
the fight.
excuses. You got to be prepared for that. Get your servers ready.
They just didn't know.
Wait, you have to be prepared for that. It's a big deal.
It's huge deal.
It's like Mayweather versus what do you call it? What do you call him? YouTube personality, big YouTube personality. It's like old school versus new school.
Yeah.
It's the whole point of bringing in the younger generation to start watching boxing since maybe like UFC and things like that are more popular now than boxing. So it was a genius idea. Genius idea to bring two different, although of course, I mean, everybody's like, okay, obviously Mayweather better beat this guy or whatever, but I just don't understand. Like, I went on Twitter. I never go on Twitter, and I went on Twitter just to see people adding Showtime and Showtime support and complaining. Oh, it was like refund. Give me my money back. I want my money back. Yeah, and then I'm all like, it kept going off on us, and I was like on TikTok Live trying to like. There was people streaming it on TikTok Live. So here I am looking at it on TikTok, trying to hit reconnect. Looking at Twitter, seeing everybody complain. It was like a complete shit show. But it was good. I mean, the bits we saw.
Dang, next time something like that goes on. Oh, yeah, look at that matchup. That picture of him and Mayweather.
How many bought the pay-per-view?
Yeah, how many?
4.8 million is what they won't know for a while. It'll take a while because they get the refunds. But there's so many different things. They'll actually report it. Maybe.
Dang.
Maybe they will. But estimated, what I'm looking at is saying like,
It's not a bad price.
they're going to earn 120 million combined total from pay-per-view revenue. That's Mayweather
40 million people.
and Logan Paul.
Oh,
combined.
that's trickled down. That's to them.
I know Logan Paul's portion, if I'm not mistaken, from everything I was reading, was like 20 million. Wow. So poor Mayweather's
Who do I need to fight?
Poor
Who needs to punch me in the head for me to get 20 million?
Yeah, that's what it is. That's why people are laughing. They're like, hey, why is Mayweather fighting this kid? So Mayweather is like the promotional genius of our generation. The guy has done things in boxing that nobody else has ever done. And then Logan Paul brings the younger generation in, our kids.
I think it's genius in the sense of like bringing, like the fact that like your 9-year-old daughter knows who, Logan Paul is and that this is happening
All from
solely
you.
due
And
to
his fame's from YouTube. About the younger generation to see who Mayweather is. And for the first time ever, which blows my mind, Mayweather was like the good guy. Since
why is he usually the bad guy?
he's Money Mayweather. That's it. This is how smart this guy is. Just if he was a normal boxer like everybody else, he would just be a fantastic. Like Canelo's an amazing boxer, right?
Mm-hmm.
He's famous for being an amazing boxer. Mayweather started his career as Pretty Boy Floyd.
Right.
So when he was younger, he was Pretty Boy Floyd. He was an amazing boxer then as well. And he went like 10 fights undefeated, pro, like 120 fights with a really, really good record as an amateur. This guy is like royalty of boxing as well.
Right.
So what he realized is, I'm not going to do what I want to do and be what I want to be, situational awareness, by just being Pretty Boy Floyd. He became Money Mayweather. So whether you tuned in to watch the fight because you knew how skilled he was in defense, how good he was, how fun he is to watch, and if you respect the sport, you would watch him for that reason. And plus, he was fighting like world-class talent. Or the Weekend Warrior fans would watch it to see the cocky guy that shows his watches off, talks about his stripper promotions. You would tune in to watch him get beat up. That's how smart this guy is. He would not only that, but he knew he would.
Yeah, he's like, he's
a smart businessman.
in Vegas. I got this. I got that. I was
So
like,
genius.
Oh my
And
God.
you noticed in this one he kind of chilled out on that, right? Because he didn't need to do it. He's like, I don't need to do that anymore
Except
because
for like when he walked out, he was filled from head to toe with advertisements. His hat had advertisements on it. His mask had an advertisement on it. His shorts had like 4 advertisements, like Fashion Nova.
He said
Fashion Nova is like an Instagram. That's what I know Fashion Nova from Instagram. He had Fashion Nova on the front, Fashion Nova men on the back. He had. I was like literally like look at smiles.
He's always looking to make more money.
Yeah.
He's always
just
looking
because
to
he's
make more
not
money.
bragging about it doesn't mean he's not making money.
That's
I
true.
think it's
That's
genius.
right.
Good for you. You knock it out, chicken sprout.
That's
The man's made generational money.
yeah.
Generational money. And
Which is important.
well, he is a role model for boxers to look up to.
Right.
Right? Because
Don't squander your money. Make your money.
when you get down to it, you know how there's like the show version of a person and then like the real version of the person.
Yeah.
Like you listen to the real Mayweather talk, he'll say, "My health is my wealth. I'm not going out there to get punched in the head and be
Right.
stupid." He's
So
like,
that's the
he's
one thing I
44
noticed.
years
He's like
old.
this the whole time.
Has grandkids.
Yes.
He's
The
best.
last fight that I watched, he was doing that too.
The whole time.
Smart, but that's
His
smart.
His
though. You've
defense
gotta-
is well. He's fighting a this kid's
Yeah,
freaking
the guy's
190
giant.
pounds walking in. Mayweather walks around at 155. This kid's my size.
That was funny to watch him. The Logan, he was like, he kept going like, like I was like, okay,
geez.
he's about to fall over. And Mayweather was
see
like
it.
not
Wanna
even
see.
breaking a sweat.
Wanna see.
It was impressive. Double his
there
age
any-
practically. Can I watch the fight?
No, just like a
Mayweather
clip.
highlights.
Can we get a clip? Yeah.
Yeah, they're everywhere. They are everywhere.
Oh, look how he's towering over him. You see?
He's a big kid. That's what was interesting about it. He's a big kid. He's a big kid. And they always say there's a puncher's chance in boxing. Like if you're a big guy, you could land one shot and knock somebody out, right? If you have that puncher's power.
Back when I was playing Ready to Rumble, I always picked the person who had the most reach.
Yeah.
Ready to
So the
rumble
reach was
boxing.
like a 1.5 inch difference. I think.
I'm dating myself, but you know.
See?
Oh,
See?
wow.
BetOnline.com.
OnlyFans.
I liked his walk-in.
It's
He
his
has
team
an
money.
alligator. This one had a diamond
Look at
covered
this key.
Pokemon
That's a
card.
Pokemon
Look
card.
at this key. Yeah, see, because I'm telling you, the matchup has to be he has more reach than Mayweather. But
1
I
inch.
always-
1 inch.
1 inch more.
Yeah.
1 inch can make a difference, baby.
Well,
Clearly it didn't.
Mayweather is this is a
Look at that, though.
this is a man that's perfected
he's
his
smart.
craft.
Yes.
I'll
record
put
is
this into
58
terms where
Yeah.
people can understand, where you guys
you
can
have
understand
to-
it. A kid comes out of college, first year audiologist, and tries to compete with you in the industry. Right?
But
They might be smarter, but you guys have honed your craft.
They're not smart.
And Mayweather is not only honed his craft, but he's the best to ever hone his craft. And that's what made this interesting.
fresher.
So,
It was David versus Goliath.
yes. And can I say something to the 1 year, starting out audiologist?
okay, let's hear it.
Go.
Yeah, I just want to say, we have done our time. We've paid our dues.
And when
would
I
say.
was at the beginning, I wouldn't have.
I respected the people who came
Yeah,
before me.
totally.
And so respect us. Don't undercut
I mean,
us and,
I'm just going to say something. When I was interviewing for your position prior to courting you and convincing you that you need to work with me after multiple dinners and lunches. It's okay. You were busy having a sweet baby. Taking your little break. I'm not going to... Listen, good for you, girl, for asking for a lot. But I think there's a little bit... I mean, there was a little bit of a disconnect where some of the numbers that were being thrown out at me were more than like somebody who's been working for 10 years was asking for. Which I guess made me wonder... Are they not aware of kind of like what a starting salary is? Are they just trying to like, hey, giving you the first number? Well, if I'm going to say the first number, I'm going to say it more and hope that you meet me in the middle somewhere. Like I was wondering where this was headed, you know? Yeah. And they wanted like a gajillion hours of vacation time, paid time off already. You know what I mean? Like you've never even worked in a clinic officially a day in your life besides your externship year. I'm not going to start you out with 80 hours of paid time off right now. You know what I mean? Like, I just was like, nope.
But don't you admire them a little bit for going if you ask
for aiming high?
If I walk into a room and people are like, how much do you want? Like, you don't want to know how much I want. Because if you're going to know how much I want, you're probably going to pass out and have a seizure. So if you want to know, I want to know if you the way negotiation works though is negotiation works. You have a starting point, and as the person that's needing the service completed, which is you as the owner of the practice, what you do is you say, hey, here's where we're at, and that starts the point of negotiation.
Well, I learned to do that after a couple of interviews. I was like, this is not going to work for me.
The Art of the Deal.
The Art of War for Women. What a good book.
But young Crystal Wiggins, right out of college, where were you, 29? 26? If young Crystal Wiggins cruised in here and was talking to the Crystal Wiggins of now, the Dr. Crystal Wiggins of now, what do you think how do you think that conversation would go? For a job.
You got a lot to learn.
Ask for more money.
What would she say?
Yeah. And ask for more money.
What would she say?
So I guess it's proving.
You think she would be the same as the kids that are coming in now? Would she be respectful? Would she be? You think
I was to a certain extent. I mean, because we came out with first AUDs. So we were setting.
I was the first doctor of audiology in my entire at University of Texas in Austin.
Me too at Lamar.
Because before that, I was a master's degree. It was a little confusing. Like, okay, well now we have a doctor. Do we ask for more money?
Right.
You know what I mean? Are we worth any more? Right. Well, technically, I guess we are worth a little bit more because we learned how to deal with vestibular patients, people who have dizziness, which was not so much in our field prior to that, or dealt with as much.
Right.
But yeah, that's the problem. It's okay, well, now I have a doctorate. Right. So now I need like this much minimum.
Right.
But unfortunately...
So you can empathize with those young girls.
I can empathize.
Yes.
I know that there's student loans. Heck, I'm still paying for mine. But at the same time, like... And if you can get that, good for you.
Very good for you.
But there's got to be... there
just has to be... I
think you have to... Yeah, maybe just...
Be respectful about it. Ask for the moon. There's nothing wrong with asking for the moon.
I think that's...
Just be ready.
Ask for the moon, to me, I feel like they're delusional. Like...
No, they're
maybe
young.
Ask for... What's in between the earth
This is where you're wrong. They're not delusional.
Ask for the atmosphere.
They're young. And here's the thing that you have to take in. This is why I asked you the question I asked you. You got to be empathetic to the point where you were that kid at one time. You were that kid that came out with a doctorate.
I wasn't asking
delusional.
for the moon.
Yeah, and I wasn't.
Yeah, but I also asked for more. I remember when I worked contract audiology, for example, everybody was getting a certain number, and I went about $20 over that, and I got it.
Yeah.
Because I knew I knew that I was one of the only ones in Houston that was doing it. So I knew that. What do you call it? The ratio.
What did you just say about ask for the place that ask for the atmosphere?
Ask for what's between Earth and the moon. Maybe the atmosphere.
Yeah, ask for the atmosphere. But no, I think there's a lot of truth to that, because if you do your research, if you find out the stability of the business, if you find out what clientele the patients you're going to be seeing,
Yeah.
then
much-
you kind of know where to put
Yeah.
yourself and what to ask for. That's what I think. I think, if anything, be educated about the
Yeah.
place that you're interviewing.
What it
because
means
you
is like
can't
if you're working at a sole office that does solely
Medicaid.
yeah,
You can't just ask for.
or one that does like only vestibular, dealing with
Right,
dizzy
right, right.
patients all day long.
Right.
Unfortunately, the reimbursement's not very high for that.
Right.
So you
Unless they're
might-
doing something
yeah.
shady.
Oh, well, there was that one.
If you remember.
Dallas. Oh my god.
We're not going to say when.
Fill me in. What happened?
I think they like what do you
For
call it?
every position that.
No, there was these two men. Of course, they're men. Just kidding. I'm not a man. And I want to say that
We
one was
love
at this.
y'all.
I don't even know what was whatever it was. I think they embezzled like $20 million
dollars.
out of insurance companies. I was like, oh boy.
Boy. Yeah, so.
Who did they embezzle 20 million from?
We
Like
don't know.
insurance companies.
Yeah, yeah.
They like gave everybody hearing aids when they didn't need them. They would fake, like I don't know what the story was. I think they were in Dallas.
Yeah,
so.
just okay. And the moral is don't do anything shady and don't get involved in it. And I've had numerous students tell me about things that were going on. And this, I say students, but they were my students, and then they became audiologists, and they would tell me about things that were happening. And I always told them, hey, if you're feeling like you have to ask questions about it, it might not be that good. So, like, do I get out, or how do I get out, or
Like
how do I
what?
not?
But wait. Let me back up because I want to hear this, but for some detail for me. So to get your doctorate, you guys have to spend some time working directly under a professor, and that's
Oh.
what you're talking about. Your students.
Yeah. So
You said
clinical
my
rotations.
students. Yeah.
Clinical rotations.
So
So there's a lot. There's a lot of
I used to
people that won't
there's
know.
rotations.
There's a lot
Oh,
of people
that's
that
right.
won't know what you're talking about.
have
And
to have
me, that's why I'm looking at you. I'm
experience.
like, wait a minute.
Yeah.
Where were you a
students.
professor at? Yeah, you're
So
still.
like for
professor
example,
too.
while I was in school,
There's no doubt about it. You're the professor right now. What are you talking
I
about?
experienced pediatric audiology. I experienced audiology in a like in Austin. They have Texas School for the Deaf.
Yeah.
So I worked at TS. I did rotations at TSD. So I saw what audiology. What do you call it? School audiology was. I knew
Yeah,
right away I
educational
didn't want to
audiology,
do
yeah.
educational audiology, even though the hours are good. It was just like a lot of meetings and things like that.
Yeah, the ARDs.
Yeah, ARDs. Yep.
Admission
And
review and dismissal.
IEPs or I don't remember.
IEPs, yeah, individual education plans and all that.
That's not for me.
If you
so
do
you
pediatrics,
experience
you
things
need
like that, and then
all that.
I worked in a hospital. I worked at Brackenridge
Yeah.
at the time. It was called Brackenridge. I don't know what they call it anymore in Austin, but I had to do auditory brainstem responses.
Yeah,
I remember
ABRs.
this- ABRs. I remember this
Did you
one guy.
P300s?
Huh?
P300s?
Girl, don't start.
I know. Well,
That's called electrophysiology, and I can't stand it.
Electrophysiology.
I'm gonna add
P300.
electrophysiology to this practice. I'm gonna make you in charge of it. Okay?
P300
She's
is
like, I'm gonna put it in my notice.
a character from Star Wars, right? A P300.
I just know that there was this one guy that came in one day, and he was in a really, really bad car accident, and his temporal lobe was smashed, and they were like, ripping him up and cutting and sticking catheters in places, and I remember just like a deer in
gotta do-
headlights,
you gotta
and
do
I
it.
was like, had to put electrodes on him.
Yeah,
and-
you got to do it.
and
yeah.
I was just like, ooh, crying, and everybody's like, business as usual, and I'm like,
Right.
this is not for me. This is
So
not
what does
for me.
audiology have to do with the brain?
Well, because you hear it, the brain. Your brain is what hears.
So there's ways that we can like test. For example, if there's a 3-month-old,
gonna
they
put
can't. A
Ben on
3-month-old
there
can't,
with his
or a 2-month-old
test.
can't say I hear the tone, and they're
Yeah.
still a little too young for the visual audiology that we do with like a 1-year-old, for example. So or somebody who's incapacitated. Is that a word? Is that the
Yeah.
word? What's the word when you can't? Okay.
Or a nonverbal
Incapacitated.
person, or they have.
or somebody with MR. We'll do have electrodes on their certain parts of their head, and we'll be able to read certain waves of their brain,
Yes.
and it allows us to see.
Are they? Is the auditory brainstem responding? Will they be able to hear?
It's crazy.
Did a lot of that with the pediatric practice.
I was so good at it for a while, but now
I figured you would be good at it.
I don't even
because you're.
It's like
She's
it's
very
a far away now.
Yeah, but I know you would have
knew
been
those
good at
wave
it.
fives,
Yeah, yeah. She's
I was like, Mark.
she's very
Mark,
meticulous. Yeah, she's
Mark.
very meticulous. So I knew she'd be good at
You would have to be in a dark room
electrophys.
sometimes for 3 hours at a
Yes.
time. You know, I get ADD.
No.
Self-diagnosing.
You don't get ADD. You have obsessive compulsive disorder.
I think I have.
It's okay.
ADD. No,
I'm not saying there's anything wrong
Hey,
with it.
I don't
She's
know.
obsessive compulsive to a point to where if there's a detailed thing about something that she cannot let it go.
Lies.
Well,
They're lies.
If it's something that she sees, and there's nothing
Now I'm
wrong
not
with
gonna
it.
let this go.
There's nothing wrong with it. In a lot of
I
industries,
do not have
it's a
real
good
OCD.
thing.
There's a difference.
Yeah,
there's a difference.
Well, you,
I do
wipe
not
that
have
dust
clinical
off of
OCD.
my tissue
Okay,
box.
so what if I want to wipe the dust off? It's done.
Say this, I could not be around. I didn't want to be around anesthetized patients. That's why I did
Yeah.
not want to keep doing
Yeah.
it. I mean, I loved it. I liked, seeing the surgeries and being there, and
Yeah.
But it was like, I want you to talk to me.
Or like sometimes
Tell me what you hear.
dealing with like diagnosing a kid and it's
And the parents,
Oof.
and then
it's like
and then
devastating for the
back
parents.
to tissue box. I would just tell, like I would always play this game with my students. Do you put the tissue where the parent can see it or pull it away? And so that, does that make the patient cry, or does it make them feel like they can cry with you? Because they would cry.
Yeah.
You were going to get a
I think you're gonna
crier.
get crying
but
no matter what.
it's an experience that you have
Would
to
put the
have,
tissue
though,
box
right?
out?
Yes.
I like the way you put it.
I do it. I put the tissue box out. It's
yeah,
kind of
but
on
it's
the side.
right?
You can look.
So
look
so
for it.
if you're so if you're in distress, there it is. But it's not like smack.
You
It's in your
think
face.
about stuff. I love it.
Yeah.
I guess I do too, but I don't think about
this
things. But
like your
any other
t-shirts.
particular
Sure.
advice you would
Merch.
give somebody who wants to become an audiologist? Besides reaching for the atmosphere or possibly
Reach
the
for the
wind?
atmosphere. Do I have to give them one piece of advice?
No, keep going. Let's start.
Okay,
What's the
let me
advice?
tell you something. When you start in this thing, know that it is the wildest ride. Okay. Now, what wild means is that there are going to be ups and downs.
Yeah.
Okay. So you need to take the good with the bad and roll with it. Know that if you're doing this, you're doing it with purpose. If you're not, you need to step aside and let us real folks handle the business.
I like that.
Yeah.
Can you be more specific?
More specific?
No, just
Okay. So
some thick skin.
yeah. Respect your elders. I just have to say that.
Specific
Elders as far
instances.
Elders such
Audiologists
as
or patients?
Audiologists.
Yeah.
No, I mean, definitely patients. Respect all the patients. Don't hurt the patients. But respect those that have come before you. Just because, like let's say, I haven't done vestibular in a long time. That doesn't mean I don't know about vestibular.
Yeah.
And just because you like vestibular doesn't mean that you're the top notch in all vestibular.
Yeah.
There's always something to learn from somebody.
You can always grow.
Yeah, you can
There's always somebody
grow.
better than you and smarter than you.
Yeah, you can always grow. And that's what I love about this profession is that it's changing all the time.
Mm-hmm.
You're constantly learning. If you stop learning, you die. And who wants to be dead?
And
Me.
And something along those lines is a lot of industries are competitive because a lot of people feel like they either want to be the best or that there's a limited amount of work.
Oh, yeah.
And in y'all's industry, what's exciting about it is there's 8.5 billion people.
Yeah, there's
and
plenty of
they have
This
2
is a
ears.
pie for everyone.
Yeah.
And they have 2 ears. So what I think a lot of this is, and what a lot of you guys are doing now, is to, like you said, you got to build yourself up, but then to build the other people up.
Yeah.
And I like the saying that if there's problems with the next generation that's coming up and what I do, it's my fault. Because I didn't look that kid in the eye and say, hey, listen to what I'm telling you, fella. Focus for 1 minute. I got something you need to listen to.
Now, I'm not
And this
telling
is what
them
it is.
anymore, but I did tell them.
I do
And
now.
my students that are out there, they know me. Former students. Now y'all are audiologists, y'all my colleagues, but whatever. But you remember what I taught you.
But then too to bring those folks up, right, and not to put them down, not to browbeat them.
Never.
But at the same time,
because we all were students at one point.
Yeah.
My apologies for cutting you off.
No,
but
you're good.
we were all students at one point, right, Dr. Elly?
you're never going to stop being a
Yes.
student.
Yes, you're never going to stop. being a
If you
student.
ever think you're done being a student, you are the fool in the room. I think what happens through a career, and we talk about this all the time at home. There's an evolution, right? And where do you want your career to be? Do you want to? Where is it going to evolve to? And not saying you're leaving something behind, but you're going to evolve into what. And that's why you got to have a plan.
Yeah.
Everybody talks about plans. My plans are kind of bad. Is I'm like 6 months, 12 months, 3 years, 5 years, 10 years, and where are you at with those individual steps?
Yeah.
And that's where you see where you're at in life. You'll always be Dr. Wiggins, but you may be Dr. Wiggins that moved into a missionary, and now you're doing wherever your path takes you. You'll always be what you were in the past. You never you'll always be a mom, right?
Yeah.
You'll always be a wife, but your evolution in life will continue to go.
That man better not divorce me. I have warned
He
him.
will if you keep talking about Tank.
What'd you say? I have warned him.
Yeah, I have warned.
She said that with a straight face.
I sure did.
Like, they see that I have an audiology practice. They're like, I want to have my own practice one day. What advice can you give me? And I love talking to those people. And I am always like, I wonder if they're going to remember me. And some people, there have been people who I have like randomly have messaged me over like the past 4 years, like, and then they're like, I've now gotten into grad school for audiology, just wanted to let you know. So it's kind of neat to like, maybe one day I'll meet this person, like, and I've maybe inspired it, and it's not about me inspiring, but the fact that I've helped answer questions or whatever you want to call it. But when I hear a big one that I hear over and over is that owning your own practice, as sexy as that seems, and obviously working for yourself is always great. Yeah. On the back end, it's a lot. It's a lot to deal with, a lot of, bills to pay.
You guys are doctors because you care.
Yeah, obviously. Absolutely. Okay, maybe it's not obvious, but absolutely.
It should be
100,000%. We care. Dr. Wiggins and I care. I don't even want to compare our level of care to other providers, but I'm just going to say it. We care more than a lot of people I know. We care.
We do.
We truly care. We love our patients. We care about their well-being. We care through like the whole experience, like from beginning to literally end of life, like beginning to end. Never do we not stop. Never do we care. Like, I'm busy and they will ping me and ask me a question, and I will just stop what I'm doing to like make sure that person on the phone is taken care of, even though I'm like doing a million other things. Yeah. So we care, and that's why it kind of hurts. I think sometimes I take it personally. Shane's always telling me, don't take it so personal. I'm like, I can't help it. I'm taking it personally because
you put your heart and soul into it.
You put so much time, so much effort. There's so many places that I know who wouldn't even spend not even 50% of the time that we do with our patients. You know that.
Oh, yeah.
You've worked in some.
Oh, yeah.
You know this.
Oh, yeah.
It's a fact. And some patients who've been elsewhere appreciate it and know the difference, and they appreciate us more. Right, but the ones that I guess have never experienced it, they just think this is the norm. Yeah.
But it's a journey. I'll say this: it is a journey, and so when a person comes to Memorial Hearing, they're getting someone to walk the journey with them. They're not getting somebody who's just saying, "Here's your hearing aids. Bye. See ya.
Here's the hearing aids.
Hope you do well.
Throw it on the charger.
Right.
Here's your bag."
No. You're getting somebody to walk you through the journey, because a lot of people come in and they're either frustrated because of their hearing loss. They have a lot of anxiety because of their tinnitus. They have all these different emotions, and that's what Dr. Elly is. That's what equates to taking it personal, is because you get involved with the patient in those emotions. And
it's like a therapist.
Yeah. Oh, yeah.
It's therapy.
Oh, yeah.
We get involved.
Oh, yeah.
I've cried so many times.
How many times am I say, oh, yeah?
Just thinking about crying makes me want to cry.
Oh, yeah.
Another t-shirt.
Oh, yeah. Oh, yeah. It was an average Tuesday. Oh, yeah.
Oh, yeah. Average Tuesday. Oh, yeah.
Any roo ha ha.
No. But it is a journey. And most patients, it takes them at least, 7 years?
Yeah.
To seek help.
Statistically, 8 years. Yeah.
8 years to seek help for their hearing loss.
From the time they know they have hearing loss, to do something about it.
Yeah.
Not even from the time that they actually have hearing loss.
Right.
My guess is it's at least 15 years.
Yeah. Oh, yeah. And then now we have ways to measure that with Cogniview and all that stuff.
And then so I'm going to flip that coin on the other side and play devil's advocate, because I'm a Gemini and that's what I do, right?
See that other face of yours.
Yeah. So here it comes.
His twin.
So you're talking about folks no showing on appointments and not calling and not giving you enough notice. What about when the doctor is like 2 hours late to your appointment? When you're sitting in the waiting room and the ladies are at the front office and they're saying, "Can you start filling this paperwork out?" But deep down inside, they know.
Dr. Wiggins, what did we do?
The doctor ain't here yet.
We call the patient
even when we're running 15 minutes late.
Because I've got
we are, as if we know it in advance, we immediately start asking. And if it's a domino effect, if we have like 5 in a row, and we say call the next 5 patients and let them all know to come 15 minutes past their appointment time.
Right.
We leave them voicemails. If we don't talk to them, we email them. And there's an email that says late appointment notice. There's a template that we have ready to go.
So you're saying it never happens where you guys are late?
It does.
No, it does happen.
And we have the courtesy
to call the patient and let them know.
You try.
Because you know what?
Yeah, we try.
Oh, yeah.
We want to at least limit that. And
But you guys are human too.
That's true.
And you have lives.
That's true.
Running late and no showing are 2 separate things.
It's a two-way street, in my opinion, because I'm not a doctor, but I've been around doctors.
But would you just not show up for an appointment? I think that's the rudest thing a patient can do. It's rude.
Yeah. It needs to be understood is that there's going to be times, there's going to be exemptions. But just to put it out there, from a doctor's perspective, as well as from a patient's perspective, let's respect each other's time.
Oh, yes,
well, I mean,
absolutely.
I've been a patient.
It's a two-way street.
In many situations, and I don't think I just respect the other doctors' offices that I go to because I have my own office. I think it's just general courtesy. I try to be courteous even when I go to McDonald's. Like I try to be courteous when I let somebody go in front of me. But if they don't say thank you to me when I let them in front of me, then I get annoyed. Do I flip them off? No. I just get annoyed. You know,
well,
so I'm
in the car. You're not supposed to do it in the car anymore,
right? In our field, for example, like unfortunately, places like certain big warehouses and certain offices will just give hearing tests for free. Free.
Yeah,
you want free?
No.
Then go to those places.
Where they sell the suitcase bacon. Is that what they call it?
Yes,
so it's not just the place that sells the suitcase bacon and the feminine products next to your healthcare.
I had some this morning.
It's a lot of places do things like free. Like I'm sure even dentist office free cleaning, free this, free. If
what do you learn in economics though? First lesson in economics,
nothing's ever
for free.
Yeah,
thank you.
So yeah, like you can go buy your hearing aids for $8,000 and get your free test, or you can get it from us for less than $6,000 and pay $75 whopping dollars for your test. Which one makes more sense? This place. But for me, it's like. One time a patient argued with me over it after the front office staff already gave the pricing. He made it a point to in person have to tell me, I just don't understand why you're charging. And I said, well, sir, do you work for free?
Yeah.
And he just went. And then once I gave him, this was like such a proud moment for me. I gave him, as usual, the most thorough testing ever. I explained every detail from the pressure change of the ear, pressure test of the ear, to the speech test, to the understanding of what the speech test, to the air conduction, to the bone conduction. And he was so, I think, embarrassed that he even brought up.
Said that
he wrote a check for double.
What? Go ahead.
I was like,
little tip. So when you go to those providers, what are we calling them, the big warehouse providers?
It's not just the big warehouse. There's a big box, plus other places that do free.
Is there a difference in quality of service?
I believe so.
Yeah.
And you think that's what the difference is, potentially the quality of service difference and the value? That's why they're giving away free hearing tests.
They're more mass scale, right? I mean, mass-minded scale. Like it's kind of an in and out. Maybe you get a 30-minute appointment with them, where with us you'd get 2 hours. Definitely quality over quantity, I think.
Yeah.
It's because there's, and then to understand hearing aids, there's so many things that need to be done to a set of hearing aids. You can't just say, hey, you need this one, plug it into your ear and walk out the door.
Yeah, no, it's not that.
Right?
No.
So Dr. Wiggins, walk through a lot of what the setup is. And this is something we've talked about discussing in this room in detail, is the setup or what it looks like when a patient is getting fitted for a new set. So you walk in. So walk us through. So a new patient comes in, you figure out that this person is in need of hearing aids. They agree.
Are we talking about
purchase.
the fit day? Because that's one of my favorite days.
Yeah, let's talk about it.
Okay, let's talk about the fit day.
But start us off from
get all the stuff that comes with it.
Start us off from the origin.
Folder,
Please,
papers.
please do.
Why don't you just discuss it and we'll put it up on the board?
Okay, so this is fantastic. So and Dr. Elly heard me say this, but I always start this day off by saying, when the patient sits down, I say, today is the day. Today is the
exciting.
day.
I want to be here.
Yeah. Today is the day. So it's the day when that person is going to hear, take it very seriously, and tell them do not be overwhelmed because there's a lot to go over.
Yeah.
We provide everything in writing. So we go over all of those things about how to use them, how to care for them, how to clean them, what to do if there is a problem, who to contact, We set up their cell phone because now everything's pretty much Bluetooth connected. We do all the pairing. My favorite part is doing the live listen when I actually walk into your exam room and I have the patient stand up. I have them do that because I can't hear what they're saying.
You're so good. You're like, so now you're going to hear me through your hearing aids. So go ahead. Okay, go ahead and go on the side of your phone and turn the volume up. Now my voice is going to get louder. You're so good at that. You're
I love doing
an operator with a soothing voice.
I love doing it because the patient is so mesmerized by how much they're able
like
to
you
hear.
said, like we go through the whole a gamut with them.
Yeah.
Like it's like just from start to finish, you know?
Oh, yeah. And we don't leave them without support.
Memorial Hearing is the Cadillac of audiology.
And I'm Tesla, baby.
Okay, first of all, I have a Cadillac. So I'm okay, Cadillac.
My bad.
I'm just joking. Tesla, Cadillac.
Like this.
And the cat fight.
No, it's all good. It's all good. Tesla, that's fine. Go ahead, Elon. Let's talk about today's wine, eh? What do you think? So
I love it.
I don't know if you remember when Dr. Casey Layfield was here, but we talked about her. What was she called? Her gateway wine, Dariush.
Oh, yes.
That like $100-something bottle.
Yes.
So this is the same wine as Dariush, except it's called the second press. So the first squish of the grapes is the first press.
Yes.
And that's Dariush. And then they'll do another, second press. Like they'll squeeze a little whatever round that's left from them, and that's where Caravan comes. So this is used to be a $35 bottle of wine. That's how I discovered it because I like that price point. Unfortunately, I've now since fallen in love with it, and it's moved up to like 45.
And so has everybody else.
Yeah, so it's close to $50 now, but it's called Caravan, and it's I think it's pretty damn amazing.
It follows the Dariush.
It's 60% Cab, and then whatever percent other stuff, Merlot and something else.
And I never liked Merlot. But this blend is
I'm just kidding.
But
Caravan, you like it?
I like it.
Yeah, so you can get this anywhere.
usually-
I've even seen this at HEB. You can get it, of course, at like Total Wines and Specs.
yes.
They have it at every grocery store. I'm pretty sure top shelf. Good stuff. Like definitely 2 thumbs up on this one. We love Caravan.
I like it.
Well, this was nice.
Yeah, this was
You like the
nice.
wine?
I do like the wine.
Do you think it was nice to see you here?
Yeah, it was pretty fancy.
Fancy seeing you here. Silly.